Hi, and welcome to episode 90 of Toke Signals TV, where we bring you the biggest in cannabis and hemp news stories every week. I'm Steve Elliott, the editor at TokeSignals.com, and I'll be guiding you through the news. First, let's look at our Toke Signals Bud Pick of the Week. Have something yummy for you this time. This is Chocolate Thai, a sativa dominant that I found at Quality Patient Care in Everett this week for the bargain price of just $25 an eighth. It's kind of ironic because I had just visited a 502 recreational marijuana store down the street where marijuana was $20 a gram. So straight from there to $25 an eighth and one stop. Now I know I'm not supposed to talk about marijuana prices according to our masters at Facebook, but Facebook can fuck off because I'm in the business of providing information. Let's do the news now, shall we? In the United States this week, we have some big news as the Obama administration removed a crucial barrier to marijuana research. In a long-sought move anticipated by many marijuana reform advocates, the White House on Monday announced that it was removing a major obstacle to marijuana research, the Public Health Service PHS review. Representative Earl Blumenauer, a Democrat from Oregon, welcomed the decision of the U.S. Department of Health and Human Services to eliminate the PHS Review Committee for non-federally funded medical marijuana research, an additional review process not applied to other Schedule I substances, just cannabis. Last year, Representative Blumenauer had led a letter signed by 29 other members of Congress to the Secretary of Health and Human Services, Sylvia Matthews Burwell, requesting that the PHS process be eliminated. Today's decision by HHS is a significant step towards improving an antiquated system that unfairly targets marijuana above and beyond other substances in research, Congressman Blumenauer said. I applaud the administration in heeding our request and the request of many to eliminate this barrier. I hope this action will facilitate easier access to marijuana for medical researchers, Representative Blumenauer said. Considering the widespread use of medical marijuana, it is absolutely essential that we allow doctors and scientists to research the therapeutic benefits and risks of its use. There is still more to be done to ensure this happens, according to Representative Blumenauer. He said, I am working on legislation to address these issues, and I look forward to working with the administration and my colleagues in Congress to further increase research. The president has often said that drug policy should be dictated by unimpeded science instead of ideology, and it's great to see the Obama administration finally starting to take some real action to back that up, said Tom Angel, chairman of Marijuana Majority. But there's more to be done, Tom told me. The next step should be moving marijuana out of Schedule I to a more appropriate category, which the administration can do without any further congressional action, according to Angel. Given what the President and Surgeon General have already said publicly about marijuana's relative harms and medical uses, it's completely inappropriate for it to remain in a schedule that's supposed to be reserved for substances with a high potential for abuse and no therapeutic value. Hopefully today's action is a sign of more to come. This action shows that the White House is ready to move away from the war on medical marijuana and enable the performance of legitimate and necessary research, according to Bill Piper, Director of the Drug Policy Alliance's Office of National Affairs. This is progress, but the White House should also end the NIDA's unique monopoly on marijuana production and allow private entities to grow marijuana, thus facilitating even more important research. The U.S. government has systematically impeded marijuana efficacy research, and the PHS review has played a large role in that stonewalling, according to Dr. Sue Sisley. It was a shameful tactic used by opponents of marijuana research who never wanted the public to see objective data about the efficacy of marijuana. To see the government finally eliminate this waste of taxpayer dollars is a triumph and hopefully represents another historic shift in drug policy reform, according to Dr. Sisley. As we witness the tide of marijuana reform in American politics, sometimes it starts to look like a tsunami, because 2 days after that story, we had senators telling federal agencies to remove barriers to medical marijuana research. At a Wednesday hearing, Senators Cory Booker and Kirsten Gillibrand pressed federal officials to eliminate political barriers that are preventing research on the potential medical benefits of marijuana. The hearing, Cannabidiol, Barriers to Research and Potential Medical Benefits, was held by the Senate Caucus on International Narcotics Control. Officials from the National Institute on Drug Abuse, the NIDA, and the Food and Drug Administration, the FDA, echoed the senator's concerns and expressed support for removing barriers to research that have been created by the Drug Enforcement Administration, the DEA. The NIDA has a DEA-mandated monopoly on the supply of marijuana available for research purposes, which is grown at the University of Mississippi in Oxford, Mississippi. Researchers have repeatedly criticized the DEA for refusing to license additional marijuana producers, which they say is preventing the study of marijuana's medical benefits and the development of marijuana-based medicines. They have also criticized the poor quality and low potency of the scant marijuana that is currently available, which they say further hinders meaningful research. A DEA administrative law judge ruled that licensing additional producers would be in the public interest, but the DEA has refused to follow that non-binding ruling. NIDA Director Dr. Nora Volkow has indicated that she agrees the monopoly hinders research and that it should be ended so that additional suppliers can be licensed. The head of the DEA Office of Diversion Control, Deputy Assistant Administrator Joe Ranazisi, gave no indication that the DEA agrees such a monopoly is a problem or that it has any plans to license additional marijuana producers. The DEA is waging an irrational war on marijuana that is costing people their lives, said Dan Riffle, Director of Federal Policies for the Marijuana Policy Project. They are standing in the way of research and the development of potentially life-saving medications. While the DEA is clinging to reefer madness, there are seriously ill people clinging to their lives who could be benefiting from medical marijuana, according to Riffle. The DEA is preventing children with seizure disorders and people suffering from diseases like cancer and AIDS from accessing a medication that their doctors recommend and that could dramatically improve the quality of their lives. When President Obama took office, he mandated that policymaking in his administration be guided by evidence and the scientific process, rather than politics and ideology, according to Riffle. Clearly, he said the DEA didn't get that memo. It's absurd that marijuana is still classified as a Schedule I drug with no accepted medical use, Riffle said. Scientists need to be able to do the important work of developing marijuana-based medicines and putting them through the FDA's approval process. Marijuana is far less harmful than alcohol, and like alcohol, it should not be included in federal drug schedules, Riffle said. Marijuana is the only Schedule I drug that is forced to deal with the single government-enforced monopoly for access to study the drug, said cannabis PTSD researcher Dr. Sue Sisley. This monopoly has proven over and over again that they are incompetent and incapable of providing the various strains that are requested by scientists in a timely manner. In 2014, Dr. Sisley received approval from the FDA for a major study on cannabis use to treat post-traumatic stress disorder among veterans. However, that study continues to be on hold as the NIDA has not been able to produce the requested strains of cannabis. In Oregon this week, Portland police released a guide to legal marijuana. With Oregon set to legalize marijuana on July the 1st for recreational use, the Portland Police Bureau has released a guide for cannabis consumers which explains just how much weed is legal under Oregon state law. The guide explains how much weed you can carry in the most Portland way possible, reports KATU, by comparing an ounce to the size of a voodoo donut. Voodoo Donuts, which I recently experienced for the first time, is a Portland institution popular among both cannabis users and the public at large for its big, tasty creations. While Oregon's law allows just an ounce to possess while you're out and about, you can have up to 8 ounces at home. Anything more is still illegal. Driving under the influence of marijuana can still get you a ticket, as can using it in a public place. But if you see someone smoking pot in public, police are urging you not to call 911 unless there is an immediate public safety risk. They truly don't want to be bothered. Even the cops know that it's a dumb waste of their time and your money to arrest people for smoking weed. The same goes for any scenario where you smell marijuana from your neighbor's home or yard. If it's bothering you, Portland police said you should discuss it directly with your neighbor and don't call 911. Transporting marijuana from Oregon to Washington, as tempting as that might be, since it's going to be a lot cheaper in Oregon, would be a violation of federal drug laws. And as we get ready for legalization in Oregon, The Oregon House approved a bill this week setting up the legal marijuana market. Oregon House lawmakers on Wednesday passed a bill 52-4, setting up the state's legal marijuana market after voters approved legalization under Measure 91 last November. This bill, HB 3400, now heads to the Oregon Senate. The bill creates regulations for both medical and recreational cannabis, including a compromise allowing local jurisdictions to opt out of legalization. Members of a House Joint Committee charged with implementing Measure 91 had previously been unable to agree on the issue of local control, stalling the entire measure for weeks. Counties or cities that voted against Measure 91 at the polls can choose to ban cannabis sales if at least 55% of their residents opposed the ballot measure in last November's election. Other counties would have to put banning pot sales to a vote, those that voted less than 55% against pot. I did not support Measure 91, said clueless Representative Bill Post, a Republican from Kaiser, Oregon. I am voting for this bill because it allows local jurisdictions to prohibit the sale of the drug. The bill also creates a marijuana tracking system so bureaucrats can trace weed from seed to sale in order to keep it out of the black market. The Oregon Health Authority would be in charge of creating and maintaining a database tracking the path of marijuana to market. The bill requires grow sites to register and submit information on how much cannabis is processed and transferred every month. We want to help local businesses be successful in this legal market, said Representative Ann Leininger, a Democrat from Lake Oswego, who carried the bill. We want to reduce illegal activity and transactions that are not in accordance with these laws. We want to keep kids and communities safe. The measure, which reduces penalties for some cannabis offenses, will bring the criminal statutes in line with the reality of marijuana's legality, according to Jeff Sugarman, lobbyist for the Oregon Cannabis PAC. HB 3400 would also expunge many marijuana-related convictions, benefiting tens of thousands of Oregonians, according to Sugarman. The so-called war on drugs has devastated communities across this country, said Representative Lou Frederick, a Democrat from Portland. With the experience of prohibition behind us, we should know better. But instead, we fill prisons and break up families over this drug. Recreational marijuana possession and consumption become legal in Oregon on July the 1st. In Massachusetts this week, the state's first medical marijuana dispensary opened. 3 years after the state overwhelmingly voted to allow legal medical marijuana, the first dispensary in Massachusetts opened on Thursday. Alternative Therapies Group, based in Salem, will accept patients by appointment only. Unlike many other states, no marijuana will be grown on site, and most uniquely of all, no products will be on display in the dispensary. Patients will have to choose their products via a computer screen. So much for the old smell test. The highly coveted license was approved on Friday, and the facility will be operating in the neighborhood of Downtown Crossing, reports Linda Johnson at CapitalWire.com. Patriot Care Corporation had already been approved to open such a dispensary in Lowell, although provisionally. The corporation won the permit for a location in Greenfield as well, thus becoming the only company that has been authorized to run 3 marijuana dispensaries in Massachusetts. State officials said they are willing to allow another company to open dispensaries in Northampton and Brookline. The decision to award Patriot Care Corporation the license has drawn sharp condemnation from a number of critics who claim that company was given a special treatment. State regulators signed off on the final paperwork on Tuesday, allowing the dispensary in Salem to open. Access to the dispensary, located in a converted factory building that houses other businesses as well, will be restricted to patients with a state-issued marijuana registration card and an appointment. Police Chief Mary Butler told the Boston Globe's Kay Lazar that patients won't see any products on display, but will make their choices via a computer screen. Salem Mayor Kim Driscoll said company leaders have been open in communicating their plans to city officials. They went out of their way to meet with neighbors, officials, and others in Salem to introduce themselves and explain what they'll be doing, Driscoll said. Salem has long been a progressive, forward-thinking, and open-minded community, and we look forward to alternative therapy starting operation this week and providing yet another critical medical choice to patients for the entire North Shore, the mayor said. Under an agreement signed between the city of Salem and Alternative Therapies, the city will receive 1.25% of the company's annual sales for the first 2 years. That climbs to 2% in subsequent years. On its website, Alternative Therapies Group said Massachusetts Department of Public Health rules prevent dispensaries from advertising marijuana prices. Price information is available only to qualifying patients and personal caregivers at the dispensary itself. Thousands of patients have waited for the first dispensary to open. Alternative Therapies had initially announced an April opening, but had to push it back for 2 months. A lab which tests the company's marijuana detected lead levels exceeding Massachusetts' strict limits. State regulators and chemists at 2 labs that will be testing marijuana are arguing over testing rules. Last week, the state granted the dispensary a temporary waiver allowing it to sell marijuana that hasn't been fully tested for pesticides and other contaminants. In the United States this week, a study says labels on edible marijuana products often have the potency wrong. Most labels on edible marijuana products are inaccurate when it comes to levels of tetrahydrocannabinol, THC, the principal psychoactive ingredient in cannabis, researchers reported on Tuesday. An analysis of 75 products sold to patients in Seattle, San Francisco, and Los Angeles found that just 17% of the labels accurately described THC levels. 60% of the products had less THC than claimed on the packaging, and 23% of them had more THC than advertised. We need a more accurate picture of what's being offered to patients, said Dr. Donald Abrams, Chief of Hematology and Oncology at San Francisco General Hospital. Dr. Abrams wasn't involved in the study, which was published in JAMA. Products with too little THC may fail to deliver symptom relief, and those with too much may make users feel uncomfortable or anxious. Cannabis candy, drinks, and baked goods from 47 brands were tested in the new study by the Workshop, a laboratory with branches in Washington State and in California. The study was paid for by Johns Hopkins University School of Medicine, except for the cost of the lab testing, which was covered by the Workshop. The company's CEO, Jeffrey Raber, is listed as a study author. In one case, a product that had just 3 milligrams of THC had a label claiming 108 milligrams, according to Ryan Vandry, lead author of the study and associate professor of psychiatry and behavioral sciences at Johns Hopkins. The researchers wouldn't name specific manufacturers of products, apparently unwilling to stand behind their own lab results. I didn't want to get sued, Dr. Vandry said. The point is not to say, hey, X medical marijuana company, you're bad, he said. The more serious issue, he said, is that we don't have the kind of quality assurance for edibles that we have for any other medicine. According to the study, edible medical marijuana products in Seattle were more likely to have less THC than advertised, while those in Los Angeles were more likely to have more THC than advertised. The researchers also tested each product for cannabidiol, CBD, a non-psychoactive component being studied as a possible aid to children with epilepsy. 44 products had detectable CBD, although only 13 listed it. 9 had less than labeled, 4 had more. In California this week, in our final story, the legislature there moves to end transplant discrimination against medical marijuana patients. The California Senate on Monday approved AB 258, the Medical Cannabis Organ Transplant Act, by an overwhelming margin of 33-1. AB 258 prohibits discrimination against medical cannabis patients in the organ transplant process, unless a doctor has determined that medical cannabis use is clinically significant to the transplant process. Medical cannabis patients in California are routinely removed from the organ transplant waiting list if they test positive for cannabis use, even legal doctor-recommended medical cannabis. AB 258 was authored by Assemblymember Mark Levine, a Democrat from San Rafael, and sponsored by Americans for Safe Access. AB 258 is about fundamental fairness and compassion, according to Don Duncan, ASA's California director. Legal medical cannabis patients should never face a choice between their doctor-recommended medicine and a life-saving organ transplant. AB 258 will help the law catch up with science, which has shown that medical cannabis patients are just as likely to benefit from an organ transplant as other patients, according to Duncan. On June 15th, more than 200 patients and advocates participated in the ASA California Citizen Lobby Day, which focused on educating lawmakers about AB 258 and other medical cannabis legislation. ASA's membership has been working tirelessly to pass AB 258 for 2 years, according to Duncan, and its passage represents a big victory in the fight to end discrimination against medical cannabis patients when it comes to transplants. Hope you choose to join us next week. Until then, stay lifted. See you then.